Hello everyone, and in today's session we'll see about seizure under the topic neurological disorders and assessment. So we'll see what is seizure and its type, symptom, causes, treatment, and an example case study. And now we might have come across the word in many cases seizure or fixed. The seizure is nothing but it isn't fixed. So even in our family members we'll see a person with fix. If they're having a fix, we could have given some steel objects in their hand to control their fix, and excessive body shaking or everything. So now we'll see what is exactly a seizure is. A seizure is an abnormal electrical activity in your brain that causes a change in awareness and muscle control. So here, when a brain gets abnormal electrical activity and your brain gets collapsed, and in return it affects your awareness and muscle control, it making you stood shaky and tremble everything. It is a very dangerous neurological condition, and it is most common with many people. And now here there is an availability of treatment, but we cannot cure. So we can reduce the severity and frequency and symptoms of seizure, but we cannot cure this condition called seizure. And now, not all seizure look same. Some might shaky, some might staring at one place. So we have different kind of seizures. And now we see types of seizure. In major broad classification, we have main two classification, that is generalized seizure and focal seizures. Where generalized seizure affects our electrical activity will be disturbed. So we'll be having particular electrical activity in our both parts of the brain, like both side of the brain, the electrical activity will be getting disturbed. Whereas in focal seizure, these electrical signals and functions will be totally abnormal. Here, everything will be disturbed, and here, everything will be abnormal. Okay, in generalized, where electrical activity starts on both side of your brain at the same time, so you may having both side of your body shaky, trembling, and severing, etc. Usually it affects kids and young adults. So where focal electrical activity begins in one side of, like get a clue with focus. It focuses to one side of your brain that leads to one side of paralysis or shake it to your body. So this actually means that you may or may not remember the seizure after once the seizure gets completed. So initially it begins with one side of the body, and by typically day passes, it spreads to both side of your bodies. And now we'll see in depth what is generalized seizure main subtypes. So we have absent seizure. So in absent seizure, you stop what you're doing and have a blank stare. You will be staring at one place. So you will be not able to communicate, or you will be not able to express your feelings. So you will be like statue and rigid at one place, and you will be staring at one particular point without any disturbances. That is a kind of seizure. An atonic seizure. So atonic seizure also called drop seizure, where your muscle control will be affected. You will lose your muscle control, and suddenly you will drop down. You will fall down without any control or balance in your body. Next, clonic seizure. So clonic seizure is nothing but where your both side of your body will be shaked, and you will get a pass, and again after few minutes you will be getting a shaky of your body. And myoclonic seizure is nothing but they involve a quick jerk or twitch of your body parts, or your group of body muscles will be getting twitched or will be getting rigid. Next, secondary generalized seizure. Now secondary generalized seizure is you have a focal seizure followed by generalized. So when a patients get initially generalized seizure, and as day passes, it leads to an focal seizure. And tonic-clonic seizure is nothing but your muscle gets stiffened and you lose consciousness and have convulsions. Tonic seizure is nothing but you pass out and your muscles tightened up and you don't have any convulsions. Yes, next comes here focal seizure. Focal seizure is nothing but, as we know, focusing at one point of seizures. Okay, focal onset aware and focal onset impaired awareness. So, focal onset awareness seizure, you are aware of your seizures and when it happens and able to remember it when it happened, where it happened, whomever was there, everything you can able to recall and you will be aware. And focal onset impaired awareness seizure is nothing but you lost awareness and experiences confusion when the seizure happens and can't remember the seizure, you will be not in your aware conditions. And next, symptoms of seizures. So, main symptoms of seizures are nothing but loss of control, uncontrollable movements. Other symptoms may include emotional changes, drooling in your mouth, teeth clenching, eye movement affecting, loss of bladder control, bowel syndrome, and noise making. So, what is a clinical feature that could be diagnosed for seizure is loss of consciousness, convulsion that is jerking movements, muscle stiffness, sensory disturbances, and after seizure you will be having a lot of confusions. And stages of seizure. First, we have four stages. First, prodromes phase, next aura phase, next epical phase, next postical phase. So, what causes seizures? Provokes seizures are triggers could be a temporary condition or certain circumstance cause seizure symptoms to happen. So unprovoked seizure happens spontaneously, randomly, without any conditions. So we have, as I said, we don't have any treatments to cure seizure, but we can control, like managing any underlying causes or conditions, or taking seizure condition with medications, like surgeries if they have any particular blocks or uncontrollable electrical signals in your brain. So brain stimulations. So this is an example case of an 20 years old Ravi having seizure, and their clinical features are listed out here. So thank you. Next session we'll see about stroke.